So our presentation is how our senses, specifically smell, affect seizures. Okay. Oh, there. To start us off, we're going to be talking about sensory seizures. I'm sorry. I don't know why I can't say it. To start us off, it is important to understand what exactly a sensory seizure is. While doing our research, we gathered a definition of a sensory seizure. According to research done in Cedars-Sinai Medical Center, a sensory seizure is defined as follows. A seizure is unusual electrical activity in the brain. Sensory seizures can affect the five senses, which are touch, taste, hearing, vision, and smell. Cedars-Sinai Medical Center also goes into different symptoms of sensory seizures, but one specifically affects our topic. One of the symptoms is smelling things that are not there. That is where our continued research goes to understand how the sense of smell affects individuals with epilepsy.
So just going over some quick definitions about our smell and seizures. Our ability to perceive odors is important for our daily lives. And so we wanted to analyze how the sense of smell affects people differently who experience epilepsy. Our olfactory system is the sense where smell is perceived. And these functions include detecting desirable foods, hazards, pheromones, and has a role in taste. For example, the smell of smoke helps us detect dangers in our environment or determining spoiled foods or drinks. Epilepsy is a chronic brain disorder categorized by a persistent predisposition to epileptic seizures. And research has found that olfactory deficits are present in patients with epilepsy with effect sizes in the moderate to broad range for various olfactory domains, including odor identification, memory, discrimination, and perception threshold. Odor disorders are the most prominent with patients with temporal lobe epilepsy and mixed frontal lobe epilepsy. So looking into our first study, we looked at a study that looks at olfactory dysfunction, which causes structural and functional changes in the brain, which this can decrease the quality of life. So this study evaluated peripheral and central olfactory regions in children with epilepsy using an MRI and compared findings with a healthy control group. So cranial MRI images were obtained from 23 children with epilepsy and 23 healthy control children. The peripheral region used the olfactory bulb and volume and the olfactory succulus depth, and the central region examined the insular cortex area and the corpus amygdala area, which we'll look at brain scans of that later. So the seizures are divided into four main groups: focal, generalized, unknown, for example, epileptic spasms, and unclassified. And so this study mainly looks at the focal and generalized types of seizures. So in seizures, there's stereotypical properties, which involve olfactory experience, which elicit emotional responses through the amygdala activation and processing. We know that a decrease in the sense of smell can be expected in all types of epilepsy. And epilepsy-induced nerve damage may affect the central olfactory region. In this study, patients with epilepsy often reported experiencing olfactory abnormalities, which generally include olfactory auras where malodorous smells are reported. So this study used the MRI, the magnetic resonance imaging, because it was non-invasive to investigate olfactory disorders. Results showed that there were no differences in OB volumes, the olfactory bulb volumes, and OS, the olfactory succulus depths in the peripheral olfactory region of epilepsy patients and the healthy control patients. In the central olfactory region, the insular cortex and corpus amygdala areas in the epilepsy group were significantly smaller in control groups. The OS depth on the right side was significantly higher in both groups than the left side. And there's positive correlations between each of the OB volumes, OS depths, insular cortex areas, and corpus amygdala bilaterally in the epilepsy group. A quote from this study is that we conclude that a change in the areas of structures in the central olfactory region in epileptic patients may be related to central tissue damage due to epilepsy. These findings have important implications for epilepsy research, as early diagnosis and treatment can potentially prevent a reduction in the volumes and depths of components of the central olfactory region in the pediatric population. So this study is really interesting because it looks at a specific population, and this one was analyzing children. So the first figure looks at the both olfactory bulb areas and volumes measured at max volumes. And the second figure looks at bilateral corpus amygdala when monitored at max volume. And so these are images of brain scans from the cranial MRI measurements. And for patients with epilepsy, epileptogenetic areas near the amygdala can negatively impact patient performance in odor discrimination and odor recognition.
All right, so our next study was a quantitative analysis of olfactory dysfunction in epilepsy. So this source, it was a study completed by the National Library of Medicine. So several individuals who worked in the medical field came together. So it was individuals who were doctors, who have their master's, or even just their bachelor's degree in somewhere in the medical field. So research or a nurse or whatever it may be, they came together to run a study in how olfactory dysfunction affected epilepsy. So just pulling a few quotes from them, olfactory dysfunction in epilepsy is well documented in several olfactory domains. However, the clinical specificity of these deficits remains unknown. So therefore, they decided to run a systematic meta-analysis in order to have a better understanding. So the aim of this systematic meta-analysis was to determine which domains of olfactory ability were most impaired in individuals with epilepsy, and to assess moderating factors affecting olfactory ability. So moving forward with the study, the individuals in the medical field began to work with patients with different kinds of epilepsy. So kind of like Kateri was talking about with the different kinds in her study, but within children, this study focused on more of adults. So included studies measured olfaction using tests of odor identification, discrimination, memory, and detection threshold in patients with different types of epilepsy, including temporal lobe epilepsy, TLE, mixed frontal lobe epilepsy, -E, and mixed epilepsy, and then the acronym for that is MIX. After running the study, the data came back giving the researchers a clear understanding of their questions. Their questions being, how did the olfactory dysfunction affect epilepsy? So olfactory deficits were robust in patients with epilepsy when compared to healthy individuals, with effect sizes in the moderate to large range for several olfactory domains, including odor identification, so that data point being -1.59, memory, -1.10, discrimination, -1.04, and detection threshold, -0.058. So their conclusion brought back points that were originally questioned with our first source. So if you recall, when we first started our presentation, our first source from the medical center, the Center-Sinai Medical Center, deemed that those who had sensory seizures, specifically with their sense of smell, could smell something prior to their seizure occurring. So for instance, when Kateri and I were trying to dive into what topic we wanted to discuss, Dr. Candace sat down with us and said, sometimes those patients or those epilepsy will smell like an orange scent before they have a seizure. So just something to keep in mind. And this was also proven in our study that we researched. So overall, these meta-analytic findings indicate that the olfactory system is compromised in epilepsy and suggest a detailed neurobiological investigations of the olfactory system may provide further insight into this disorder. Patients with epilepsy often report experiencing olfactory abnormalities. Clinically, these abnormalities include olfactory auras in which typically malodorm smells are reported, although not actually present. So again, going back to our first point, smelling something before the seizure occurs. So yeah, just a symptom of a sensory seizure is that you're able to smell things that are not present. So the final step in the research process was to understand how they could give those with epilepsy clear answers on understanding why the sense of smell is triggered in a seizure. So olfactory dysfunction is reported in both pre and post-operative cases of epilepsy. Nonetheless, the clinical specificity of olfactory deficits and the clinical value of olfactory performance testing in epilepsy remains unclear. Arguably, it is possible that it tries accurate and cost-effective approaches such as olfactory performance testing may aid traditional neuropsychological testing, may aid traditional I must have typed that twice. I apologize. To better elucidate seizure focus and post-surgical outcomes. So the last and final step was to identify the ways in which the brain responds to an olfactory response. Seizures involving an olfactory experience often elicit effective responses via amygdala hippocampal system. In patients with epilepsy, epileptogenic areas near the amygdala can negatively impact patient performance in order discrimination and order recognition. As such, olfaction holds a unique role in perception as major afferent projects from the olfactory bulb project, ipsilaterally, not contralaterally, into the cortex and may provide information about the epileptogenic areas within the brain. So in conclusion, through our research, we have dug deeper to better understand just how the olfactory system affects those with epilepsy. We have found that those with epilepsy and their sense of smell go hand in hand based upon one of our first points that before someone has a seizure, they oftentimes smell a scent that is not there.
So both of us now have a greater knowledge of this topic, as well as the class material that correlates with the olfactory system. And through our discussion that we will lead in class, we will dig deeper into these sensory-related seizures.
So thank you guys so much for watching our video. And then these are our references if you want to look at them before and read through the articles before we present on either Tuesday or Thursday. But thank you guys so much.